Thank you so much to everybody for your very intelligent and impassioned comments and presentations. I've been listening really intently. Um, One of the things that's concerning me, and I'm sure it's concerning you too, is the twin pandemic of overdoses and addictions and the rising deaths that by our young people, middle-aged people, many people who are are getting the disease. It's a disease, and it's very concerning. So the pandemic has cast a really grim light on the ongoing crisis that we've been facing in Canada for many years, the overdose epidemic. But I notice while some cities have significantly higher number of overdose deaths than others, the need for harm reduction services and calls from advocates for a safe drug supply is continuing to rise across the country. And also, I noticed that there's an increased risk of deaths and overdoses if the substance supply shifts, and especially if newly contaminated substance, including fentanyl or its analogs, are introduced into the communities. So, what exactly are your communities doing um, to prevent or to counterbalance this rise in activity? Madam Poitras, would you mind going first, please?
Thank you for your question. And the mental health concerns have been a real issue that has been dealt with, not only with the increase in suicides and overdoses, but also in domestic abuse and even having safe places for the women and their children to go to. That's an issue. And some of the things that we've tried to do is have our elders, because they're a very important part of our fabric in society and our ceremonies. But like I said, those things have been scaled back because of COVID. So
Right.
so, and then some of the issues that ways that they've tried to deal with them is to go online, to have counseling services or somebody to talk to. But the issue, of course, is of people not having, the technology to be able to do that, like from elders to young people. So it continues to be a concern, and I think that the way that we need to deal with it is all of us come to put our heads together and address these issues in a good way, because it's going to, now with the numbers that are rising, we have COVID fatigue, and people are just like, well, yeah, I'm positive, and one of the things I hear is that people are recovering from it, so I'm just going to go out and continue to party or do whatever. So those are issues that we're dealing with, and those are very really concerning issues. And I don't think it's only in the First Nations,
No,
the
it's not.
Indigenous,
Yeah.
it's everybody. So
Yeah.
so we
Yeah.
all have to come to the table to deal with it effectively. Thank you.
Certainly. Mr. Obed, do you know if the naloxone kits are available widely, or what's happening on that end of things?
I'm sorry, I don't have a specific response in relation to that question. I was going to, and I can get you that information
Thank
along with the other promised information to the committee. In relation to harm reduction and safe drug supply, in our Inuit Nunagat communities, there's we just don't have the resources for a lot of those types of facilities to exist, and there are a lot of challenges that come from not having um, harm reduction principles being employed within our homeland. Uh, but for urban Inuit and for Inuit who are at risk, uh, who are homeless or um, on the streets in many cases, there needs to be more support for urban Inuit organizations and for First Nations, Inuit, and Métis specific organizations that provide support at the community level across Southern Canada. They do amazing work with almost no resources, and there needs to be more support for those institutions.
I agree.
We're right past our time now.